Our passion didn't start with the mouth. It started with people, with the well-being of the profession, and if you're like me, maybe a little bit of your nerdiness in all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on the tech, and listen to your gut while you take care of teeth. And let's get honest, the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Hello, everyone. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, RDH, your hostess of the Dental Handoff. Today, I have with me the wonderful Erika Flateau and RDH. I met Erika at RDH Under One Roof, and I was wowed by her, just the energy that she exudes and her background, and had a chance to connect with her. Erika, you're a light in the profession, and I'm just so grateful to have gotten to know you recently and want to know more about why dental hygiene. We always just jump right into it. Why dental hygiene, and why did you choose the career that you did?
Well, so I was in high school and I decided I wanted to be a teacher. So I went to community college, honestly, practically, just financially, couldn't go off to university, and was at the community college level getting the basic English 101 and all that taken care of, and realizing very quickly that going off to university wasn't in the cards for me financially. So I thought, okay, what am I going to do? What am I going to do? Because I needed a job. And I saw these gals walking around in their scrubs, and I was like, well, what are they doing? And someone said, oh, those are the dental hygiene students. And I was like, are they getting jobs? And they were like, yeah. And I was like, okay, that's what I'm doing. And at the time it was a practical, I knew that I needed this to move on with my life. And I was out on my own. And I realized that dental hygiene found me because I was meant to be a hygienist, and wanting to be a teacher. Guess what? I'm a teacher every day. And so I am in education. And I ended up being clinically really gifted at dental hygiene, and then developing the relational part that I ended up finding out that I had something special when I connect with patients. So now 20 years later, I realized that it was all meant to be. And I am so grateful for my community college education. And it was a long road, even though it took 7 years. I mean, it was 2 years of prerequisites, another year of prerequisites, retaking them to get my 3.5 to a 4.0. And because those math and science grades, with only accepting 20 students a year, they had to be 3.9 or above. And then finally taking a year off to intern as a dental assistant. That gave me extra points to get in, finally got in. And then 2 years in the program, took the boards, state and national boards. And then 7 years after that, I was an RDH. So it was a long road, and it was a really life-changing, and I grew up a lot during that time. And since then, have always been able to take care of my family and take care of my patients. It's been, so far, a very rewarding career.
Wow, what a great story. So you've been in clinical practice this entire time.
I have been full-time, except for the 6 weeks I took off to have each one of my girls. So other than that, and the 2 months we were all closed down for COVID. Other than that, full-time for 20 years. And so I figured out last weekend, just for fun, I think I've done an estimated 25,000 hygiene appointments.
Wow.
Yeah.
Wow. I don't know that many of us have estimated how many lives we've touched through what we've done.
Mm-hmm.
but you're right. I mean, if you do it full time for so long, and it sounds like you've got some special gifting, and just talking to you, I know that you do. I don't, Erica's going to tell us all about it, but Erika has this way of connecting with patients in a way that it helps to understand what they value, connects with them differently, more so than we probably learned from hygiene school from a motivational interviewing standpoint. Erika, tell us a little bit about the technique that you use.
Well, something that I've learned over the last 20 years was that my approach with patients really changed when I started really truly believing in what I do as a hygienist. And that may sound silly because, of course, we believe in what we do. We graduated, we took our boards, we take care of patients every day. We're excellent at our scaling and root planning. We can take an FMX like nobody's business. We can co-diagnose restorative treatment. We believe in what we do. And I think it took a while for me because a lot of times we're having to inform patients about disease, about things they're not exactly all that excited to hear, and getting really real with myself and getting over feeling like I was delivering bad news or I was feeling bad about any of it. It truly took some time because I was very timid in some ways of informing my patient and educating them. And so my method, it authentically changed when I started understanding that we change lives and for the better, and that the things that I'm doing are getting that patient one step closer to oral health, if not general health. And without me recognizing it and informing them, then there's not going to be any improvement in that department of their lives. And so when I started believing in what I do as a hygienist, the words just started to flow out of me, and my connection with the patients started to involve them more. So when it sounds a little corny, but I'll say to them, I'm going to do my absolute best job that I can do on you with all the skills that I know, but I truly cannot do this without you. And, their home care and them coming in and them being part of it, it really changed my delivery. Bringing them in as part of the success of what we're doing together, they start to change. They start to ask more questions. They start to say, boy, I'm here for my 3-month with Erika. They start to understand the disease process. They start to say, hey, I brought in my electric toothbrush because I wanted to see if I'm using it the right way. And getting away from talking to patients all the time about what they're not doing and looking in the rearview mirror as opposed to looking out the windshield and what we can do together to take them to that next step. It was a big change for me, and it was a big change for my patients because they stopped feeling I could see the shift in them. There's no more talking about being shameful or regretful about what I haven't done when I come in to see Erika. It's about our continued encouragement and success together, because we're both human. And sometimes I even talk to them about the ways that my home care has suffered in the past, and I've had to make some changes. And when they're like, whoa, a hygienist? Like a hygienist I went through a time of life when she didn't feel like brushing her teeth.
Right.
Yes, it happens to all of us. And really connecting with them that way has changed my approach and my method. I could go on and on. It then transcends into you working with your doctor and co-diagnosing restorative treatment and being their person that they really rely on and that they trust and that they know is my heart's in it. And I'm just such a tender heart and so sentimental, but I really do care for my patients, and they feel it. And that's where that connection comes in.
Yes, you said a lot there too. You started off by saying you realized what it meant to you,
Mm-hmm.
what being a hygienist meant to you. How did you discover that? Of course, you can say, okay, I realized the impact I'm making. Was there something that happened? Was there an article you read? Personal reflection, development?
I think that it was definitely personal reflection because right out of school, I've done personal development as well, but right out of school, we're taught to really talk to the patient all the time about what they're not doing. And we kind of talk down to them a little bit. We have them take a toothbrush and show us how they're brushing, and the whole time they're knowing they're doing it wrong, and we're standing there, judging them, and understanding that a lot of the things. I had a wonderful education, but you come out feeling like you're so used to perfection and feeling failure and you're being judged by a lot of people, and those standards have to be there so that we are good clinically and we have our skills. But I think that our approach has to change, and when the patients aren't feeling as though they're failing, they come in. I mean, how many times have you had someone come in and say, "Oh, you're really going to be mad at me?" And it's like, oh my gosh, no, I am not going to be mad at you,
Yeah.
not in a million years. And so, but I didn't understand that I wasn't supposed to be doing that to motivate someone. I'm not going to motivate someone. Especially if they're motivated by being shamed or regretful, they're going to go home and maybe do what you're asking them to do for a short period of time, if at all, but usually not at all, because they feel like I failed, so why even try? So I think that learning a lot, I suppose personally about myself, that we all have to keep moving forward, and we can't look in the past and except to learn from it, but not to ever sit there and feel, shame and regret. And so that's where I started thinking, well, my patients are going to feel this way about their oral health and their oral hygiene. And so how can I reach them in a way that's going to be more effective? And the method works. And when you believe in what you're doing, you believe that we believe in perio, for instance. There's so much untapped and undiagnosed and under classified disease going on in our practices. Yeah. And I'm going off, Kelly, here, but this is the part that I mean, we're doing 6-month prophies. It's what the people expect. And there's some people that fit into that category, but there's so many that either you're a new person and you have to have a tough conversation, or you're a hygienist that's been seeing them for a long time and looking at them with some fresh eyes and saying, there is more that I could be doing for this patient, but I don't want to have that tough conversation. Or they're going to say, did something change? Why this now? And it's a really good way to segue into it is perio charting and images, both for perio. So it doesn't matter which appointment you're at, you can have the conversation based on those tools that we use. And I can get more into that if you'd like.
Yeah. And then, I mean, too, because I know burnout is such a big deal. I mean, and it has been, and it is. I think it was happening even before COVID, and we just weren't talking about it in the same, we weren't saying the same things. We weren't using the same language to describe it. So with what you're talking about, it brought you out of that place to really feel like you were being rewarded by your profession again. So what advice would you say? Listen, if you're in this place, if you are talking to people right now and you say, if you're in this place, here's my advice on what you could do.
That refresh and vigor to come back, that spark. So yes, ultimately changing lives and seeing the results in your patients and their compliance, that will give you that lift, of course. But also, we got to give ourselves a break. A lot of us are type A personalities. We're perfectionists. I have learned over the years, the person comes in, it doesn't matter what they present with. You're supposed to, and that's me from school too. Everything is supposed to be perfect. So by the end of that hour, it can be checked by 2 separate people and there better not be anything left. Especially dealing with perio. Someone comes in, okay, you didn't put the calculus on their teeth. You're not the one that didn't come in for 6 years, but we own so much of our patients, their stuff, because we care about them so much, and it's the type of people we are in this profession. So what do? Okay, well then, if they're in your chair and you're assessing and you're spending this time educating and you're supposed to complete X, Y, and Z, and you're reactivating this patient, or there's someone that just hasn't really been managed, even if they are on time, for recare. Give yourself a break. Give yourself a break and know that you're going to have them back. Trying to be a hero and wave your magic wand and get everything done in that hour, you're not prepared. You're mentally not there. You don't have a plan. And when I started saying, okay, this person's in my schedule for a prophy today, I'm going to go ahead and take care of this prophy, have the doctor in, do these things, and then I'm going to have them back. And when I have them back for scaling and root planning, this is all part of this appointment. It's been explained, and they're ready to go. I'm prepared, and I don't have that weight of, oh boy, should I start a quadrant today? Should I do? No, take the time to educate them. Their compliance is going to go way up if you do that. And when I started giving myself a break and knowing what I am capable of in that hour, and really being confident in my skills and my knowledge in that department, and having a doctor that supports me doing that, I think the weight came off. The spark started coming back because I felt like, wow, I'm really the expert in this. I'm the professional. The doctor is supporting me. The patient is trusting me, and really getting through your day that way. And then when they come back and they're properly scheduled, I think the burnout goes down because you're running the department. You're in the driver's seat, and you're giving yourself a break. That allowed me to have the time to connect with them more, to educate them more, and to get that connection with them. And I feel like the burnout goes down because you don't feel like you have a chain around your ankle attached to the hygiene chair, and you are running behind the entire day, and you're feeling exhausted and you're feeling overwhelmed. And I think a lot of that, when you start to take control of the situation, and you're thoughtful about your planning with the patients, and they trust you because you believe in it. And that's what I'd like to highlight. It comes through in the way that you're speaking to them.
Yeah. And so what I hear you saying too is if it's been a person who's not been appointed to you for a while, or perhaps the condition of their mouth has changed because of some type of oral systemic link, what I hear you saying is if you're recognizing that it's not a healthy situation, that you don't put the pressure on yourself to complete that prophy, then you're saying, okay, let's take this opportunity to talk about what we found on the assessments. Let's bring you back for what's indicated, just like they would for a medical procedure. We are not going out to do this today because we haven't allocated the time. We found this. This is what you have, and it requires a different procedure. Is that what I hear you saying?
Yes, definitely so. And you're really, you're better prepared, which makes you a better practitioner if you're having them back. And also they understand, that it really plays into them understanding this is serious because she's having me come back, and we're going to spend some special time together. And she's obviously concerned, and she has to use local anesthesia. Oh, I need to get, we need to go back through this again. It really sets it apart as something that has changed, or something that's special that is needed again. And then also the part that you were asking me about having the burnout reduced. Yes, you can still get burnt out with easy 45-minute prophies if that was your magical world that you lived in because of the repetition. So starting to connect with your patients and being more of an educator and more inspirational to them on that level, that starts to uplift you as well, because you can tell that you're changing their lives. You can tell that they're starting to come in. They're not just closing their eyes, crossing their feet, crossing their arms. Okay, clean my teeth. They're really, really involved in understanding that you can't be successful without them involved. And they'll say to you, I've never had anybody spend this time with me. I've never had anybody tell me this. I had no idea that this was going on. I had no idea that this was affecting my general health, and vice versa. Thank you for taking this time with me. And when they talk to you like that, it's a whole different day in the hygiene chair.
I agree.
It's so rewarding.
And then so too, there's a piece of this that's not only, well, obviously it's always about team, as you speak to, it's about that patient care provider connection. And it's also having doctor come in to validate the findings and to be in a practice where they appreciate that approach.
Absolutely. And having a supportive, well, your team's supportive, of course, your assistants and your front desk, because when you're bringing this patient up to your schedule coordinator, they got to have your back too. Oh, yes. Okay. Erika, if she recommends this, let's make this work with the schedule and financially for you, because, it has to be that you're supporting them with your handoff and they're supporting you with just reiterating how important it is to come back. Your doctor being supportive of you and understanding that not only are you clinically skilled to do this and to take care of them this way, of course, referring if they need to be referred, but if it's something that you can handle in your scope, in your practice, for them to come in and just confirm what you've already found. And, oh, I totally trust Erika. She knows what she's doing. She's going to take great care of you. And I completely agree. And so we'll see you back soon. That any doctor, they're just doing themselves as far business wise, such a favor to let the hygienist really have that autonomy and that, let them handle what they're an expert in, and that's our department. And for them to come in and be supportive of it, it makes a huge difference, not only it builds my confidence to have that type of support, but it also gives me the freedom when I'm talking to patients to not feel like, oh, should I say this or not? Mm-hmm. It's like, no, I know what I'm doing. I'm the expert in this, and I've done it a ton of times, and I am ready to take care of you, and I know how to. And if we still need some more steps or we need a referral, then I'll bring the doctor in for that. But it's having the confidence to know no matter what I'm saying, he or she is going to come in and support me. And that's a lot of conversation and meetings as you start to work with each other, learning each other's philosophy and making sure that you're on the same page. Yeah. It's a beautiful thing.
And, we talked about this the other day, many hygienists don't understand how an office is run, and because we haven't really done that. Right. And we don't learn about it. And doctors too don't necessarily know how to manage and don't know the business side of it. And if everyone focuses on what their specialty truly is and is there to serve the patient and puts that at the core of it, and then learns that team communication, everybody's speaking the same language.
Absolutely.
It's a beautiful thing. And, then too, Erika, I was just thinking with the patient sitting there and they're hearing this, let's just say that they're an existing patient and it's been a little bit since they saw you, or maybe they saw a different hygienist, but there was a lapse of time, but now their mouth is different. And they say, but I just had my teeth cleaned 2 years ago, and you're telling me all this is different. How would you approach that?
Well, each person, as you know, you're never going to get the same patient twice. So everybody's going to be customized. So maybe they had a change in their life that they've shared with you, change in their health. You can't really, if you haven't seen them before, you can't really speak to, another hygienist's work or assessment of that patient. But it's what you're seeing today. And that's when I get the x-rays up, and we look at the bone together. We look at the calculus on the roots together. They listen to the perio chart numbers. There's something that's happened that day that's not only me visibly looking at their tissue, but there's something that day that has changed and why I'm recommending this. So I love to involve them and educate them on, I take the time to put that FMX up and show them what I'm seeing with the vertical defects in the bone, or there's some tartar on the roots. And I say tartar because I'm speaking to them right now. There's tartar on the roots and you can see it down here, and boy, only bone and tooth are supposed to show up on an x-ray. And if we're seeing tartar that's showing up on your x-ray, we know it's really calcified. Well, how did that get there? Blah, blah, blah. And so those are tough questions, and you have to very professionally answer them. And you just say, with time, this can build up, and it can get to a point where, then we need to use some local anesthetics so that we make sure that you're comfortable and we get under your gum line. And if we know you're comfortable, we're not going to hold back, and we're going to do a good job. And so sometimes it's just time for that again. And if you say it that way, they understand that it's part of maintenance. And so that sometimes you can say, and you've had a change in your health, or you're on this medication now that can be making it so that you have less saliva, or there's been a change in their home care. I don't go I definitely introduce the home care and keep introducing it at every scaling and root planning appointment or every recare, every maintenance appointment. But I don't go again into the blaming mode with my, well, you haven't been doing this. So it's more like, well, since there's a little more plaque today, or there's a little more inflammation, this is what the result has been. We're going to blame the inflammation and we're going to blame the plaque. We're not going to blame the patient. So it's very effective. And so there's a few factors there. So if now, when you were talking about you being the patient's been 2 years, were you saying that you'd never met me before, or is this someone that I've been seeing consistently?
Let's just say that I'd seen you before.
Okay.
And yeah, now I'm like, Erika, why this now? I mean, I've been healthy before. Why all of a sudden is it like this? Because we hear that all the time.
Yeah. Well, if I've seen you before, yes. Well, I did note that last time there was some moderate inflammation in it, in the upper left or something. And I made a note to myself to check it today to assess and really evaluate, because last time you were a little bit overdue and today you're right on time. So let's see, something like that, or vice versa. Last time you were on time, but today you're overdue. Whatever it is, if I've seen the patient before, I usually say that I noticed something and made a note of it. And if they were absolutely 100% healthy and not a speck of blood or inflammation, then I'm going to say, I've seen them before. I'm going to start talking to them about what's going on. Like, what's going on for you? And they might share. It might be something personal. It might be something in their health. And then that's going to open up the conversation for further treatment and therapy.
It's such a unique position because you truly have to read what the patient is saying and what they're not saying, to try to read between the lines to figure out how to input what it is that you're recommending in the direction that you go. So what would you recommend if you had some words of advice to hygienists on the technique that you're using? Where would you tell them to start?
Well, I would start with some coaching, and I'd love to do that. But I think that I would start with talking to them about their belief system and what they do as hygienists, and what I would ask them questions like, what's stopping you from having some of these conversations with patients? And then depending on what their answer is, it could be, I don't have time, or I feel bad, or I'm nervous about it, or I don't care. Like I've given up. There's so many different reasons that a hygienist could answer that question to me. But I believe that we're in this because we really want to be successful and we want to change lives and we want to help people. But the burnout, the fear of having to have hard conversations, I would try to really get down to believing in what we do with them and talk to them about, now, what happens when you have a success with a patient? How do you feel? Sometimes we have to talk about reading the patient. So everybody's going to, the mouth's going to be customized and the personality is going to be customized. So working on, really learning about different people's personalities and being a hygienist for any length of time, you've already got a little bit of an education about that. And so the people that you can sit in your chair and just start talking to about perio or restorative treatment that they have that's outstanding or something like that. And then the patients that they need to sit back for a minute, they need to decompress. And while you're working, you're going to maybe come across something that you probably already knew was there, but it's like, okay, so we need to talk about number 12, or we need to talk about the perio numbers from last time. And as I'm measuring, so reading your patient and understanding that they're not you're not projecting your values onto them and your reactions and your emotions and your behaviors and your personality onto them, but really trying to figure them out and meeting them where they're at. That for me has helped me have some of those hard conversations and test the waters with them. And then you start figuring that out the more people that you see. And so I want to highlight my belief in it. When I'm going to approach this patient, I'm going to remember that I'm here with a certain level of responsibility to recognize disease and inform them about it. And they're counting on me for that, whether they know it yet or not. When you do start to have
Mm-hmm.
those conversations, they become easier. The language just flows out of you because it does become more, it becomes effortless. Hygienists will say, "Oh, great, Erika. Now this is one more thing I need to spend 10 minutes on in my hygiene appointment." It's like, no, no, no. It doesn't have to be like that. It will, especially when remember, you're taking the load off yourself trying to fix everything in 1 hour. So there, now you have your time. You're still satisfying what the doctor needs you to do in that hour. You're still being productive, but you're taking the time and you're having that conversation with them. So I think that it's something that a person can start to find themselves getting being able to celebrate with patients and finding themselves invigorated by the successes. The more you do it, it's all practice. So
Really is.
yeah, and the more you practice at it, the more comfortable you get at it.
Yeah, I love that. I love how you were talking about empowering the patient. You were talking about how through the words that you're saying, you're also assessing where that patient's at and you're meeting them where they are. Because I think no matter what it is in our lives, we authentically enjoy that. Not just a cookie cutter approach of this is for you and this is also for you, but here's this customized, personalized approach based on what you're telling me and based on what I'm seeing. And let's care for you because you're trusting me with that.
Right.
So this has been amazing, Erika. I know that you have so much more to share. And how do people get in touch with you?
They can email me. It's Erika Flateau, just like it's spelled. It's going to show on the screen, right, Kelly? Yeah.
Yes.
Okay. Just like it's spelled at gmail.com. And I would love to have a discovery call with you if you'd like to reach out to me, and I can customize my ideas for possibly coaching your personally or a team. If you'd like to spend a half hour with me on the phone, we could do that. It'd be awesome.
Awesome. Well, thank you so much for your words of advice. And I love hearing what different people are doing and how they're raising the standard of care across the board with, the level of communication. It's the dental handoff. This is leadership. This is true clinical leadership within your community, with your patients, with your office. And it's also demonstrating that to the entire profession. So thank you so much for being on with us.
I really appreciate it. It's been my pleasure. Thank you so much, Dr. Tanner.
Oh, thank you. And everyone, we really appreciate you listening. And if you wouldn't mind doing us a favor, subscribe to us on YouTube and then also like us on Apple. Give us a 5-star rating. Appreciate all that everyone's doing and be well.